Is it good for seniors over 40 to use condoms? As much as people think condoms are just for the young, let me ask you this. Do you know that sexually transmitted diseases are rising fastest among people over 50? Yes, you heard that right. While many believe that once you cross 40, you don't need to worry about condoms anymore, the truth may shock you. Because when it comes to sexual health, age is not a shield. In fact, doctors are warning that seniors today face a silent epidemic. HIV, syphilis, gonorrhea, and other STDs are increasing in older adults, simply because many stop using protection, thinking it's unnecessary. Now imagine this. A 52-year-old man, recently divorced, finds new love. Excited, confident, and believing that condoms are only for preventing pregnancy, he skips protection. Months later, he starts experiencing unusual fatigue, unexplained weight loss, and night sweats. After a hospital visit, the truth comes out. He has contracted HIV. This isn't just a story. According to the Centers for Disease Control and Prevention, CDC, the rate of HIV among people over 50 has been rising steadily, with thousands of new cases every year. The reason? Lack of condom use. So let's break it down. Should seniors over 40 use condoms? Absolutely yes. And here's why. 1. Condoms are not just for pregnancy. Most people assume condoms are only useful for preventing pregnancy. But after 40, pregnancy is often no longer a concern, especially after menopause or vasectomy. But here's the shocking truth. Disease prevention is even more critical at this age. Condoms are the only method that protects against sexually transmitted infections, STIs. And these infections are not limited to young adults. Anyone who is sexually active is at risk. A medical study published in the Journal of Sexual Medicine revealed that rates of STIs among seniors doubled in the past decade. Why? Because many people stop practicing safe sex once they pass childbearing years. Dr. Karen Mitchell, a sexual health expert, explains it clearly. When seniors over 40 stop using condoms, they leave themselves exposed. Unlike pregnancy, STIs don't care about age. In fact, the consequences can be worse in older adults because the immune system isn't as strong. 2. Aging increases vulnerability to infection. Here's something many don't know. As we age, our bodies change in ways that actually make us more vulnerable to infection. For women, menopause causes hormonal changes that thin the vaginal walls, reduce natural lubrication, and increase the chances of small tears during sex. These tiny injuries make it easier for viruses and bacteria to enter the body. For men, conditions like erectile dysfunction medications, diabetes, and high blood pressure can weaken the immune system, making infections harder to fight off once contracted. That means one simple, unprotected encounter can have lifelong consequences. 3. The silent epidemic among seniors. Here's a fact that will leave you stunned. The fastest growing group of new HIV diagnoses worldwide is people over 50. According to the World Health Organization, nearly 20% of all new HIV cases are now in adults above 50. Think about that for a second. While society believes young people are reckless, it's the older generation that is silently fueling the epidemic, mainly because of the refusal to use condoms. And HIV is not the only concern. Syphilis, gonorrhea, chlamydia, diseases that many thought disappeared in the 1980s, are back, and seniors are not exempt. One 60-year-old woman in Florida shared her painful story. I thought at my age I didn't need to worry. My partner told me he was clean, so I trusted him. A few months later, I was diagnosed with syphilis. It was humiliating. I had to explain to my children why I was going to the clinic every week for treatment. 4. Emotional and relationship benefits of condom use. Beyond the medical facts, let's not forget the psychological side. Using condoms after 40 is not a sign of weakness or distrust. It's a sign of responsibility and self-respect. Many seniors report that once they return to dating after divorce, widowhood, or separation, conversations about condoms are awkward. But those who insist on protection feel more confident, secure, and respected. In fact, surveys show that couples over 40 who openly discuss condom use report higher levels of trust and intimacy. Why? Because protection removes the fear of infection, allowing partners to relax and enjoy their relationship fully. 5. Breaking the myths seniors believe. Now let's clear up some dangerous myths that are putting older adults at risk. Myth 1. I'm too old to get an STD. Wrong. If you're sexually active, you are at risk, no matter your age. Myth 2. I trust my partner, so I don't need a condom. Trust is important, but many STIs show no symptoms for years. Even if your partner looks healthy, they could be carrying an infection unknowingly. Myth 3. Condoms are uncomfortable at my age. With modern designs, thinner materials, and lubricated options, today's condoms are more comfortable than ever. Seniors who try them report little difference in sensation. Myth 4. We don't need condoms after menopause. Pregnancy may not be an issue, but STDs still are. In fact, postmenopausal women face even greater risks due to physical changes in the body. A doctor's warning. Dr. James Holloway, a geriatric health specialist, puts it bluntly. The idea that seniors don't need condoms is one of the most dangerous misconceptions today. I see patients in their 60s and 70s with infections that could have been prevented with a single condom. It breaks my heart, because these are avoidable tragedies. So, is it good for seniors over 40 to use condoms? The answer is clear. Yes, it's not just good, it's essential. But here's the real question you should ask yourself. If seniors are facing such high risks, why are so many still refusing to use condoms? Is it pride? Is it embarrassment? Or is it simply ignorance? In the next video, we'll explore the hidden social and emotional reasons why many seniors avoid protection and the shocking consequences they face. So don't go anywhere. If you found this eye-opening, make sure to like this video, share it with a friend, and subscribe for more life-saving health tips. Because when it comes to protecting your health after 40, knowledge is your best defense. Jans, Shorts.